So you might have heard that saltatory conduction or conduction of nerve impulse through myelinated fibers is much faster than nerve conduction through unmyelinated fibers. In many books, they say that saltatory conduction is much faster because nerve impulse jumps from node to node, right? Nerve impulse jumps from one node to another. Now this is quite confusing sentence. Many books do not even bother to explain this, but some books that explain this thing, they explain it by using some weird mathematical calculation and some weird explanation related with physics, which we medicos have hard time understanding. So you do not need to worry because I am here to help you. Hello, I am Dr. Aizaz from MedicoVisual.com, and in this visual lecture we will discuss what is saltatory conduction. Welcome to this visual lecture. So here is unmyelinated neuron. You can see that it passes the nerve impulse much slowly, right? But here in myelinated fibers, there is propagation of nerve impulse much faster, right? Propagation of nerve impulse is much faster, and it looks like that it is jumping from one node to another. Later on I will tell you that why this sentence is actually wrong. There is no jumping from node to node. It appears as if the nerve impulse is jumping from node to node, right? So let's start with a very basic concept that this is a simplified diagram of a nerve cell, and here is the this cell body, and these are the dendrites, and here is axon. Now let's zoom into this, and here let's suppose nerve impulse will start from here. Nerve impulse will be initiated from here and it will move towards this direction. Normally we have much more sodium outside the cell than inside. Sodium is much more outside, and sodium is positively charged, and inside the cell is relatively electronegative. There is negative charge on the inner surface of cell membrane, right? Why it is so? Because one thing that there is less sodium, the other thing is that there are many negatively charged ions here. We will not discuss the details. Let's replace the sodium with just positive charge so it will be easier to understand. Now normally this membrane, this thin membrane, is nearly impermeable for sodium, right? Because it is made up of lipids. It is mainly made up of lipids, and lipids are non-polar substances mostly, so they do not allow these charged molecules to freely move through them, right? So I am saying that it is nearly impermeable because some sodium or negatively charged ions, they may trickle in. Some sodium may trickle in, but that is very little, and that is insignificant, except in SA node of heart. We will discuss in physiology of heart that there is special leak channels in SA node of the heart, right? So here it is almost non-leaky, right? And of course here is the similar situation, but we will focus only on this side. So here we have some voltage gated sodium channels as well, but normally at resting position, at resting membrane potential, when there is negativity inside, these are usually sleepy. They are closed. Normally they are closed. They will only open up when there is positivity inside, right? But let's suppose if someone touches this neuron, of course you cannot touch the neuron, but let's suppose someone irritates this neuron by touching the overlying skin, and there will be slight and momentarily there will be a slight change in this permeability of this membrane. This permeability may slightly increase, that little bit sodium may trickle in, and that's how action potential may be initiated. Actually that is a separate and vast topic of action potential. I will not discuss that. That sometimes, of course, most of the time there are receptors as well which provide this initial charge, right? So I'm just giving an example here. So as little bit sodium trickles in, and here this charge will become positive because sodium has entered in, so there will be outside, there will be relatively electronegative, like outside will be relatively electronegative, right? So as sodium has entered in, there is positive charge, there is slight positive charge inside the membrane, and inner negative charge has been now lost. Now what happened, that this ray of positivity will wake up the sleeping channel, as the ray of sunlight in the morning wakes you up, right? So in the similar fashion, this light positive charge, it will wake up the sleeping channel, and it will open up momentarily and then immediately it will close. So it opens up and then immediately closed, but even for that short duration during which it opens up, some sodium quickly moves in along the concentration gradient, right? Because sodium is much more outside and much less inside, so sodium will love to come in along the concentration gradient. So as soon as it opens up, sodium immediately gets the chance to move in, so some sodium comes in, and because there is loss of sodium, so relatively outside will become relatively electronegative. Now here interesting thing happens. Now this sodium, rather than this positive charge is here and it is negative charge, so these positive and negative charges, rather than moving forward or moving here, rather than diffusing inside this cell, they keep on sticking here, right? They stay here, they remain here, they remain stagnant at this place. Why so? Because this positive and negative charge, they influence each other. Although there is a thin membrane that is separating them, but they are so close to each other that these opposite charges, they still influence each other and they keep on feeling each other, right? This is like a capacitor. In physics, you might have studied what is a capacitor. It is a device that is used to store charge. Capacitor consists of two metal surfaces or two conductors that are placed very close to each other, right? And in one capacitor there is in one conducting surface there is positive charge, and in the other conducting surface there is negative charge. And because they are placed close to each other, these charges, they refuse to move, right? They refuse to move and they remain stagnant here. This property is called capacitance. So here it has become like a capacitor. This inner cell intracellular part is like this conducting surface, and this extracellular part is like this conducting surface, and in between them here is, what is this? This is membrane. So because they are close together and they are able to influence each other, they do not move significantly forward. Although they move a little bit forward, but they do not move significantly forward. So we can say that they have high capacitance, they have higher ability to store charge has been stored here, so they have high capacitance, right? So there is very high capacitance here. Are you getting the point? So later on we will know that, we will understand that how we can decrease the capacitance. Clear up till now? What I think of these is that these positively charged ions, these sodium, they are like boys, and these negatively charged ions, this negative charge here, it is like their girlfriends. Even though there is a barrier which is separating these boys and their girlfriends, right? But they still want to feel each other. they refuse to move forward with their life, right? They still want to feel each other. And because I have told you that this is thin membrane, although it is resistant to movement of these ions, but it is not very much resistant, so little bit sodium it can go outside, and so this impulse that had settled here, it may die out. One reason is this, that little bit sodium may trickle out, may leak out. The other reason is that there are sodium potassium ATPases present here, which will pick this sodium and take it outside. That is repolarization. We will discuss not in this lecture, we will discuss it in some other lecture. So this impulse may die out, but fortunately nature is very kind to us, so nature has placed an other similar to this channel, an other channel here, right? And this, by the way, name of this channel is voltage gated sodium channel, fast voltage gated sodium channel. It is voltage gated because it only opens on a certain voltage, that is here when there is a certain voltage, certain positive voltage inside, then it opens up, otherwise it remains closed. So because there is another channel and here is this positivity, so it will also open up momentarily and more sodium will come, and again we need another sodium here, another what is this channel here, right? And it will open up and charge will move forward, and in this way we need many voltage gated sodium channel that should be closely placed to each other, right? So that is why how this impulse is conducted, that sodium enters in, it moves little bit forward, very little forward, and then another channel opens, then little bit forward movement and another channel opens. So these sleepy channels, they must wake up one by one, right? And because of this process is very slow. Are you getting the point? So this process is very slow, number one, and number two, because lots of channel has to be opened, lots of channels have to be opened, so this process is energetically expensive as well, economically it is expensive as well. And now this process is like moving heel to toe. So you place your heel here, then toe, and in front of toe you place the other heel, so it is like moving heel to toe, and it is much slower process. So how can we speed up this process? The problem arises when these charges, they refuse to move on with their life, right? They were in influence of their girlfriends, right? And they refuse to move forward. So how can we cause them to move on with their life? What do you think?
To move them away from each other?
Yeah, that is a solution, right? We can move them away from each other, and when they will move away from each other, they will not be under influence of each other. So how can we move them away from each other? The answer is simple, that here we have placed a membrane. We have artificially increased the thickness of membrane at this place, right? How come? This thing is called myelin, right? Myelin consists of layers of fat, right? It is a fatty substance. It consists of lots of fats with, of course, some proteins, and it is placed here, and because of this, these positive and these negative charges, they are now away from each other, and because now they are away from each other, they can now within no time they can move forward, right? And here we have another channel that will open up because of this positive charge, and another myelin sheath here, and more sodium will come in and it will move forward, and of course we have myelin here, and these points in between this myelin sheaths, these points are called nodes. They are called nodes of Ranvier, right? So we have these nodes of Ranvier, and now this movement, it is much faster here. from here to here. This is called electrotonic movement of ions. So this is carrier mediated. It was using this carrier, this channel, this carrier protein. So this was carrier mediated diffusion, but here electrotonic movement. So electrotonic movement is much faster. So now we are using more electrotonic movement and less usage of these channels, less usage of passive diffusion. So that is why now this movement of nerve impulse, this propagation of nerve impulse will be much faster. So it is like running rather than placing your feet heel to toe. It is like running where you are placing your feet much far apart from each other, and that is why you will reach your destination much quicker. Right, so that is how myelinated fiber works. Another thing that I forgot to mention here is that here we have decreased the capacitance. Right, in unmyelinated fibers capacitance was much higher, but here capacitance is very low. The other thing is that we have not only decreased the capacitance, but we have also increased the resistance. The resistance that is offered by this membrane to this movement of these ions. So now not only they cannot feel each other, but they can also not leak out. The sodium also, it cannot leak out from here and reach to his girlfriend. So that is a bit of sad love story here. I don't know why I am obsessed with these love stories, but this is sad love story. But sometimes you have to drift away from your love life and focus on your work. Right, so here what we are doing with these sodium ions and these girls, that we are drifting them away from their love life and want them to focus on their practical work. Clear? So here is the complete animation of movement of this propagation of nerve through myelinated fiber. So sodium comes in, stimulates this channel and dies out, right? Boom. Clear? So that's how it happens. First sodium comes in and faster electrotonic movement here, then slow entry and boom, faster electrotonic movement, slower entry, boom. So that's how. So here you can see it looks like that it is jumping from node to node. Actually this nerve impulse was moving from here to here, as you have seen in the animation. It was walking here from here to here, but because it moved so fast from here to here that it looked like that it has jumped from here to here. So it had jumped from here to here. So that is why they say that in saltatory conduction nerve impulse jumps from node to node, and this word saltatory, it comes from somersault, the stunts that acrobats perform, that jumping thing, right? This is movement through unmyelinated fiber. That impulse have to enter from this channel each time, right? And that is a slow process. It will enter, stimulate next cell and die out, enter, stimulate next channel, not cell, and die out, and so on. So that is, you can see unmyelinated fiber is much slower. Let's compare these two. So myelinated and unmyelinated. Just understand that this electrotonic movement is much faster. So here you can see that it has completed this propagation. It has transmitted the message from here to here, but it is still stuck at this point. Actually, in this demonstration, this saltatory conduction, it is still a bit slower. In real sense, the saltatory conduction through myelinated fibers, it is about 15 to 300 times faster than transmission through unmyelinated fibers. Right, so that is how the conduction of nerve impulse occurs through myelinated fibers. Thank you so much for watching this video. Please subscribe to this channel, please like the video, and please give your comments regarding this video. Thank you.